Hey everybody, this is Dr. J here, and today I want to talk about something that's near and dear to my heart, which is leadership. We are in some very challenging times right now, and I've done a couple of webinars over the last several weeks, and I really wanted to get into greater detail around what leading through crisis looks like and having a much stronger sense of a plan, a playbook, and the steps to execute that playbook. So that's what we're going to talk about today, and looking forward to going through this process with you. Again, we're in unprecedented times. The number of cases affected with COVID-19, the number of deaths continue to rise, and it's rising even more so in the United States. As I do this webinar on March 31st today, total cases are up, and certainly fatalities are up as well. And you know, right now we're not seeing any clear end in sight. When we look at some of the other data from the Institute for Healthcare Metrics and Evaluation, we do see that ultimately the peak is probably going to be sometime, or at least the predicted peak is going to be sometime around mid to late April, possibly in some states even early May. But again, the number of deaths per day and the resources that are required to manage this crisis is going to go on now for the next several weeks. Right now it's the end of March, and we can pretty much expect that we're going to be dealing with this at least through June, when it looks like the curve starts to flatten out. Now, the good news is, when I looked at this data about 3 days ago, the curve wasn't flattening out until July. So I think a lot of the steps that are being taken amongst public health officials, as well as the general public, is speeding the rate at which this curve may flatten. But nonetheless, whether the curve flattens in June or July, the crisis that this particular epidemic, this pandemic, has created will go on for months afterwards. We're going to feel the effects of this for many months afterwards. And while we're talking about leadership through a crisis as it relates to COVID-19, this is just a case study, and I think the elements of leading through crisis actually are exactly the same through any crisis that you go through. Now, there could be slight modifications here and there, but the core elements of being able to lead through crisis are consistent. And so we're going to talk about that today. I think it's important for everyone to just take a step back, take a deep breath, and realize, you know what? All of us as leaders have stumbled. We've all fallen. We've all come across or come up against obstacles that we thought we couldn't overcome. And the next thing you know, we get back up, we figure it out, and then we overcome. And I don't believe that this is any different. This is new. This is a little bit frightening and scary, but it's not something that we can't overcome, and we will overcome it. John Chambers, the former CEO of Cisco, said, "This is a marathon run where you will be sprinting at times." And the point of this is that, again, this is going to go on for many, many months, even after the curve flattens. As business leaders, as business owners, we're going to have to really understand what this looks like from a 12 to 18-month perspective. That is our map. I mapped out financials the other day looking at our decrease in business across all of our clinics, and then had to figure out what different ramping schedules look like once we were able to get back to normal business operations. And I did a 25% increase, a 50% increase, a 75% increase, and a 100% increase month over month, thinking about what it might look like to ramp up under these different circumstances, because I'm projecting that this is going to be going on for a time. And all of you out there that are watching this webinar really need to do the same. This is at least 12 to 18 months of pain that we're going to be going through. And I'm an optimist. Like, I am not being pessimistic, but I am being realistic. Excuse me. One of the other important quotes that John Chambers came out with in terms of the most likely scenario, the most likely outcome, and the greatest opportunity is that tech will help us drive through this and enable the next generation of companies and standard of living for our country. Things are going to change forever. You know, we've rolled out telehealth in our practice, and I would envision that probably somewhere between 10 to 15% of our future volume and revenue is going to come from telehealth. People that are not even coming into our practices to get adjusted. I think that's a real likely scenario. We've been very involved in onboarding technology for, the last 10 years. It's just something that I think is part of our company's vision. And so when we came up against this crisis, we were prepared for online meetings. We were prepared for people to work at home. We were prepared for telehealth. And so we're in a pretty good situation at this point. But for all of you out there that are thinking about what's next and what's now, understanding the importance of technology is going to be critically important for your current success, your ability to get through this crisis, and your future success as well. When it relates to leading through any crisis, it's very, very important that you are hyper-focused on your North Star. So what is your North Star? It's your mission. If you don't have a mission statement, like that should be something that you're working on. If you're not seeing patients, working on your mission statement. It literally tells you and the universe why you exist. And so when communicating to your team, when communicating to the public, your patients, other colleagues in the healthcare system, being clear about what your North Star is and why you're doing the things that you're doing to maintain your focus on your North Star is critically important. Our mission statement is inspiring and empowering a healthier, happier world. And every decision we make in this crisis and beyond is always leading us towards inspiring and empowering a healthier, happier world. And it becomes a rallying cry. It's critically important that you have this mission statement and that your staff knows and aligns with your mission statement in order to get through this crisis and come out stronger on the other side. There are many, many challenges in any crisis, and certainly this COVID-19 crisis is no different. Lots of leadership challenges, and that's why we're going to have this conversation. That's why we are having this conversation today. A few days ago, a really good friend of mine, Jeff Lesher, who is a management consultant, I would say guru, he's an expert. He's coached me for many years. He's worked with all the large consulting companies, and he's worked with companies large and small as a consultant. He sent me this article from the Wall Street Journal that's entitled, "COVID-19 was a leadership test. It came back negative." And one of the quotes in the article was that leadership is what actually prevents a pandemic. So essentially the article is saying, like, there's a universal leadership fail here. Not only did we not prevent this pandemic, but because of leadership decisions or lack of decisions or missteps, this thing got out of control. There were probably, and I can't predict the future based on the past, but my estimation, and I think the estimation in this article, is saying there were probably really important steps that could have been taken long before this even happened. And certainly when it started to break out, things that could and should have been done that were not, and therefore the leadership test failed. And so we need to learn from that individually and collectively. They also quoted Dan Heath in his book, Upstream, really the focus being, how do we handle things upstream so nothing bad goes downstream? You know, how do we make sure that we're managing decisions and making good decisions so that, you know, we can ensure that bad things don't happen in our future? And a quote in the book, it says, "We usually define heroes as the people who save the day. But what about the people who keep the day from needing to be saved?" And I think that's a really important statement. And we as business leaders have a responsibility to actually keep the day from needing to be saved. That is our responsibility. By the way, nobody knows about those decisions. Nobody knows about those really critical things that are being done behind the scenes to prevent people from being saved, because you would know, because nobody needs to be saved. But it's those leaders that think ahead and that are able to essentially be egoless and decide, like, we're going to do this in order to make sure that nothing bad happens down the road. And those are really the exceptional leaders of our time. So now we're going to get into the nuts and bolts of the playbook. And as it relates to the nuts and bolts, there are 7 Ps that I would use as kind of reminders or as placeholders, as the agenda for the playbook. So it starts with positive mindset. Then we're going to talk about your personal health and well-being. We're going to talk about your personnel. Then we're going to talk about how you manage patients through this crisis. Then we're going to talk about communicating with other healthcare providers. Then we're going to talk about the health of your practice. And then lastly, we're going to talk about performance of all of these strategies. And another important word that I would use as a synonym to performance is execution. Business leaders talk about execution all the time. And we're going to close out this webinar with the concepts and the steps of execution. So let's start with positive mindset. I have conversations with people on my team all the time. I mean, literally everything starts in your brain and how you're thinking about what's happening to you. There are many famous quotes out there, and I forgot who said it, but it's like, it's not what happens to you that matters, it's how you react to it that does. And so how we think about the incoming data, the sensory input that's coming to us is incredibly important. How we process that data is even more important. And so we can look at all of these things as challenges and assign fear to them and assign anxiety to them. And those are all normal emotions. And I'm not saying that we shouldn't have those emotions, because they're normal, they're human emotions. But we need to be able to compartmentalize to a degree and say, like, okay, I'm scared, or okay, I have a tremendous amount of anxiety around this. And what's next? And what do I need to do in order to make incremental changes? What do I need to do in order to place little bets where I can look at my little bets and see, am I succeeding here or am I not? Do I need to change that little bet and pivot and maybe move in a slightly different direction? But you've got to be able to compartmentalize those negative emotions and get into a place of positive mindset so that you can actually focus on solutions. Your brain can only occupy one thought at a time. So you're essentially either in a state of suffering or you're in a state of positive mindset. And so when you recognize that you're in a state of suffering, it's critically important that you stop, ask yourself why, and then make a decision, make a new decision. And as my friend David Bayer says, and I'm going to talk about David in just a second, you make a new decision. And your decision is, I'm not going to think about the negative. I'm going to focus on what needs to be done in order to have not only a positive mindset, but to create positive outcomes. So I mentioned David Bayer before. He is a personal development guru. He's a buddy of mine, great guy. His work has changed my life. But he talks about the 5 primary drivers. And here they go. So we all have these beliefs that have kind of taken over our brain since the moment we came out of our mom's womb. Like, we develop these beliefs over time through experiences, through what our parents tell us, through what our teachers tell us, through what our pastors, our rabbis, our imams tell us. We develop these beliefs. And those beliefs drive thoughts. And those thoughts drive feelings. And we act on our feelings. We don't always act on our thoughts, but we definitely act on our feelings. And those actions drive results. And those results either reinforce or change our belief system. And so we have the opportunity to make a new decision when it comes to our beliefs and our thoughts. We may have a belief, I'm scared we're never going to get out of this. And that's the thought that comes from that belief, like, oh my God, we're never going to get out of this. But if we make a new decision, like, we are going to get out of this, and your feelings change because you're now empowered to think, like, if we're going to get out of this, I know we're going to get out of this. What do I need to do in order to get out of this? It changes your actions and it changes your results. David's work is based in neuroscience, and I'm probably not doing it justice. He does a much better job than I do of talking through this process of the 5 primary drivers, but you get the point. It starts right here between the ears. And so you have to really be able to control your beliefs and your thoughts, make a new decision, change your feelings, change your actions, and ultimately your results will change. And I will tell you, I've lived this. I truly live this, and it is so incredibly accurate and so powerful. So I want you to apply this information so that you can make a new decision and get better results. Again, David's amazing. He's got some free resources on his site. He's got what's called the Mind Hack program, because we're literally reprogramming the way that we think. He's got a free PDF. Download it, read it, use the workbook. It's all there for you for free. He's got free videos online as well. Watch his videos and really pay attention, like listen to what he's saying and think about how it applies to your life so you can develop a greater ability to have a positive mindset. Another element of how we think is called a growth mindset. The notion that we can actually grow and change, that we can do things that maybe previously we thought we couldn't do. A lot of this started out with Angela Duckworth and the principle of grit, and I'll talk about that in just a second. But a lot of the, a lot of the work done by Carol Dweck, she's a scientist out of Stanford, looked at our ability to actually learn and grow. And we all have a growth mindset. We all have it in us. Now, some people are living in a fixed mindset, but we all have the ability to have a growth mindset. So I encourage you to watch Carol's TED Talk. It's a great TED Talk. You can read her book. She's got lots of resources online. Check it out. But building a growth mindset is literally, it is the strength between David's ability to make a new decision, helping us make a new decision and really change our belief system and hack our minds, and Carol's ability to help us have a growth mindset. It's like the strength, it's the power of our brain that helps us do everything else as it relates to leading through a crisis. And the third element of this, because there really are three, is the concept of grit. Now, grit by definition is the intersection of passion and perseverance. And you can see some of the words that are used to describe here, some synonyms: courage, bravery, pluck, mettle, backbone, spirit, strength of character, strength of will, moral fiber, nerve, fortitude, toughness, hardiness, resolve, determination, tenacity, perseverance. All of this is the element of grit. And again, Angela Duckworth, she's got a great TED Talk. She also wrote a great book. It's titled Grit. I would highly encourage you to check out these resources because all of these things allow us to get through these crises as leaders. In Angela's research, she found that grit was the #1 predictor of success. The #1 predictor of success. So the higher level of grit people had, the greater their achievement levels were. You can actually go to angeladuckworth.com and you can actually take the grit score test and you can get a score for your level of grit. I've done this several times. My score changes over time. Sometimes it's better and sometimes it's gotten a bit worse. The most important thing is that when you're actually taking this test, that you be honest with yourself. One of the most important elements of being a great leader is self-awareness. And so when you're taking the test, don't take the test to get a high score. You know, don't kid yourself. Take the test, be honest, know what your baseline level of grit is, and then use these other strategies of having a growth mindset, of doing a mind hack, of making a new decision in order to develop more grit. All these things that are focused on your personal development, I promise you will make a difference. I am not the same person I was 5 years ago. I am definitely not the same person I was 10 years ago. I'm not the same leader. I'm not the same person. But all of this work in personal development, it takes effort. You got to put the work in. All this work in personal development has allowed me to handle this current situation and whatever comes my way in the future in a manner that's what I would call calm. There is concern, but there is calm concern. And I'm able to keep my head around the things that need to get done in order for us to be stronger on the other side. You can do it too. Just put in the effort, put in the work on yourself, and you will get there. So we've covered positive mindset. Now let's go to personal, just your overall personal well-being, steps that you can take to improve your well-being in addition to ensuring that you can grow your positive mindset. So some tools that I absolutely love. I use a 5-minute journal app. It's on my phone. I do it every single morning. I journal. It doesn't even take 5 minutes. It takes probably 2.5 minutes. And I go through the top 3 things I'm grateful for, what's going to make the day great for me, and then an affirmation. And then it also allows me to add a picture, which I actually really enjoy because I love taking pictures. But it sets my day up for success. It puts my mind in the right mindset and I'm ready to go. These are the things that I have to get done in order to have a great day. And there's so much literature out there on gratitude, like how important gratitude is. And many times the things or the people that I'm most either upset with or frustrated with, I actually put that in my gratitude list. I change the mindset. I change my frame of reference. I change my context. So someone might have upset me the day before. I'm grateful for them because you know what? I'm going to learn from that. So great app. Love it. Check it out. You can download it on the Google Play Store and on the App Store, on the Apple App Store. Exercise is critically important, especially during stressful times. Committing to exercise 30 minutes a day is a great way to keep your mind and your body healthy. During this time right now, 2020, spring of 2020, Headspace, which is a meditation app. I've gotten really great feedback from it from other colleagues and other people who work with me on my team. They're actually allowing you to use this app for free if you're a physician. So if you have an NPI number, put in your NPI number and you can use it for free. And I think that's just a really cool thing that Headspace is doing. One of the websites that I love that's part of my personal development journey is called happify.com. It's a really cool site. There's all kinds of positive psychology data and information and exercises that you can do on the site. Martin Seligman is the father of positive psychology. Angela Duckworth, the person I mentioned earlier who developed this concept of grit through her studies at University of Pennsylvania, works under Seligman or worked with Seligman. And so all of this information is evidence-based. I mean, this is not like hoity-toity, you know, we're going to wave some crystals over your head and, you know, we're going to have a shaman, you know, with a bone through his nose, like praying over you, and all of a sudden you're going to be like this amazing, healthy, you know, smartest person in the world. Like, this is really evidence-based information to use to make yourself healthier and happier. And then lastly, as it relates to times like this where there's so much economic stress, I highly encourage you to look at your personal budget and find ways that you can really buckle down and really make spending decisions that are most relevant to your business as well as to your personal finances. The next P is all about your staff, your personnel. When it comes to your personnel, communication is the key. I can't state that enough times. Like, I've said to my own team, like, I am going to be over communicating with you. So if you thought you were getting emails and videos from me before, you ain't seen nothing yet. Like, I'm going to do emails, I'm going to do videos, I'm going to do town hall meetings on Zoom where we're all going to get on a call, a video call, and we're going to talk about what's going on. And, you know, as many channels as communication that I can use to work with my team, I'm in each clinic each week for my team, and I'm having personal conversations with them as well. I'm doing we call our meetings, our group meetings, level 10s. We call my direct report meetings my one-on-ones. I'm having a one-on-one with my clinic directors. I'm having a one-on-one with my leadership team. I'm having a level 10 with the clinics. So regular meetings are very important. Same time, same day, same agenda. And if you want more information on this, just reach out to me. I'm sharing my email with you at the end. We have an entire process in how we run our business called the Chiropractic Entrepreneurial Framework, and that's how we run our business. And so if you want more information on that, I'm happy to share that with you. But for now, this is all about communication. As many channels as you can. Think about the messaging that you're sending. Always do your best to keep it as honest and transparent as you possibly can, and all the while trying to stay positive as well. So, you know, no fluffy stuff that really is not helpful. Anything that's ambiguous is definitely not helpful. And you want to, again, be concise, clear, honest, transparent, and as positive as you can possibly be. When it came to this particular crisis, we worked with our HR company to develop a policy, like clarity around exactly what was going to happen, how we were going to maintain safety as it related to guidance from the CDC, how compensation plans were going to change. We had some of our staff going from salary to hourly. We had some of our staff taking massive pay cuts. I took a 50% pay cut in my salary, and really everybody on our leadership team did. So all of these elements of things related to compensation we had in our policy because we need, and we needed to, and we may need to, even in the future, change compensation plans depending on the business and economic environment. We were very transparent in our policy about layoffs. This is what's going to happen with layoffs. And these are the resources that are available for you if, in fact, you're laid off. I had meetings before the S really hit the fan. I had several meetings with all of my people talking about these were real possibilities. Like, this could happen to us. If we go the way of China and Italy, then, you know, our business could have a decrease in volume. We could have a decrease in revenue. We may be forced to shut down. And these are the things that could happen. When it started to happen, our policy was ready. We came out, we shared that policy with our team, decisions were made, and there was clarity around what happens next. Also, because, you know, I want to be as helpful as I possibly can, we have made a sample policy. So we took out all of our own company information, and we just created a generic policy that's on our website. So if you go to Kaizenovate.com, you'll see that there's a coronavirus playbook. You can just click on the link that says sample policy and download it. It's in Word format, and you can modify it however you need to. I will say this, if you have an attorney or you have somebody on HR that can look at it for you, that's always helpful. Like, we had an HR company look at it, but I'm not an attorney and I'm not an HR specialist. So it's your responsibility to get it checked out once you modify it for your practice. Another really important tool that we use is called question storming. This came from a book by Brene Brown who's a fantastic author. And this is all about asking questions so we can innovate, so that we can think about what we do now and what we do next. And in a question storming session with your team, we ask questions that start with the phrase, how might we? How might we get through this crisis? How might we generate revenue through this crisis? How might we connect with our patients through this crisis? How might we connect with our team that was laid off during this crisis? As many questions as you and your team can possibly come up with. How might we prevent this from happening in the future? Whatever the questions are, you list them out on a whiteboard or a virtual whiteboard on a computer or on a piece of paper, and then you prioritize the most important questions. Now, many times you'll have very similar questions, so you group those together, create a better question, but then you pick the top 3 and you answer those questions. The best answers come from the best questions. So starting with questions rather than ideas is really, really important. There is no bad question. Everybody has the opportunity to just pose a question and throw it up there, because with every question that comes out, there's an even greater likelihood that an even better question will come from that. I facilitated many, many, many sessions doing my advocacy work in the profession as well as internally with my team. And I'll tell you, we have come up with some amazing ideas and strategies and executed those strategies just from a question storming session. So I highly encourage you to plan time for that as you now begin to work on the business through this crisis. I would be remiss if I didn't talk about ethics as it relates to this crisis or any other crisis. Now, you know, my brain is in the context of COVID-19 right now, so that's really what I'm thinking about. And so I'll talk briefly about the ethics around this. There's lots of opinions about whether or not chiropractors should be staying open or closing their offices. We're open. We're taking care of a specific type of patient. You know, we're not taking care of people that are not ill, that are coming in for maintenance or sports performance or whatever. We're taking care of the most acute patients that need our care, and the ones that also we're trying to keep out of the hospital and the ER and the urgent care centers and the PCP offices, so that we can be a support system for the overall healthcare system at large. But there are lots of people that have lots of different ideas about this. And the interesting thing is, for me, I don't know that there's a right answer, but I do think that we have to ask ourselves the questions every day, every hour of every day, around the ethics of our decisions. And we have to have conversations with our team. I did it today. I did it yesterday, asking questions. How do you feel about the decisions that are being made? And this is not a leadership thing. Like, you're not just asking your leaders. Like, this is where you sit down with everybody on your team and you ask them how they feel. You have to connect with them. It is about the relationship, because you're going to get truth. You're going to get ideas. You're going to get context from people that are actually on the front lines, either sitting at home because you've decided to close your office and you've had to like close down your doors, and you know, what are the decisions around that, or what are the feelings around that, or what are the ethics around that, or the folks that are actually on the front lines taking care of patients. So, you know, it's always the elephant in the room. Sometimes it's scary for people to go there, but I can promise you, how your team engages with you after you have discussions around ethics is remarkable. They're going to be so much more tightly bound to you and committed to you, because you're willing to go there with your team. So have those discussions. It is the elephant in the room, but you've got to go there. Also in our policy, you know, we talk about the guidance that we use. Again, today, someone on my team said, yeah, we heard this and we heard that. And I'm like, guys, look, there's a lot of information out there, and a lot of it is not good information. It is fake news. And so for this particular crisis, you know, I'm going to 2 sources. I'm going to the World Health Organization, and I'm going to the CDC. The data that I showed you earlier is interesting, but when it comes to policy, these are the 2 choices that I use. Now, in the future, there might be a different crisis, and the point of this particular slide is you've got to find credible sources of information. Nothing is going to be perfect, but the more credible the information, the better the data that you have, the better decision-making you can handle and you can take care of. The next P is patience. And this is, again, really all about connection. So for us, how can we deliver relevant and valuable services virtually? So even before I get into that, I will just tell you that we're calling every single one of our patients and or emailing them. We are finding ways to connect with them for one purpose and one purpose only, and that is to check in and see how they're doing. It's not to get them back on the schedule. It's not to get them to schedule an appointment in 3 months or 2 months or whatever. It's like, how are you doing? Are you okay? Is your family okay? And there's got to be a true connection there, because there are people out there that are really suffering. And it's our responsibility as healthcare providers to really connect with our patients and make sure that they're doing okay. So, so we are reaching out. That's a given. And I would highly encourage all of you to reach out to your patients to make sure that they're doing okay. But we're also finding ways to connect with them virtually. So again, I said earlier, we use a lot of technology in our company. We've had telehealth, excuse me, for several years. And so using telehealth strategies has been an amazing way for us to connect with our patients. In addition, we're also sending out a patient satisfaction survey. It's actually a patient loyalty survey called the Net Promoter Score that's going to all of our patients that have experienced this interaction with our patients, because it is different. Normally we get to put our hands on them and we adjust them, and some of them we've known for years and become our friends and we hug them before we say goodbye to them. It's different now. There is none of that. And so we also want to understand, what is the patient experience? Excuse me. And so we're sending out a patient satisfaction Net Promoter Score, which identifies their level of loyalty, how much they enjoyed the experience after each one of these visits, so we can get some feedback on how we're doing. We're also using our web exercise platform. It's a home exercise platform that's all video-based exercises. There's libraries, progressions that we create for our patients. We're updating that on a regular basis so that patients can actually progress to a degree with them not coming in. And then we've also got a home exercise library as well that we can utilize at any given time for any of our patients that need additional exercises. Now, just for anybody who's watching this video right now, for all the chiropractors that are out there, there are codes that we've listed on this slide. If you want 30 days free of telehealth services through ExamMed, or if you want 60 days free of web exercises, just use the codes that are on here that are listed on this slide. You can go to those websites that are listed, put in those codes, and you'll get some free time to use these platforms. Again, the CEOs of these companies are very good friends of mine. I'm like, we need to support the profession. Let's do something here to help these folks get acclimated to these technologies that can be so beneficial for connecting with their patients. And so they're willing to do that. And so I want to give a big shout out to Faraz at ExamMed and Dave Cruz at Web Exercises. Thank you guys so much. If you guys are interested, please use that. If you do want access to our video library, we are also making that video library, the Kaizenovate video library, completely free and available to you guys for 90 days. So different platform, but it's just, isolated exercises that if you find you're interested in, you can use them. Okay, staying connected. We're also staying connected with our patients using social media. Every day we're posting to our Instagram and Facebook stories. We're doing live events, live workouts. We're taping courses on neck pain progressions and low back pain progressions and shoulder progressions, all these helpful exercises that can help our patients while they're staying at home. We're doing a video session on the immune boosting opportunities as it relates to nutrition. The main thing as it relates to talking about immune responses is to be evidence-based, because there's a lot of people out there that are using studies and extrapolating the data and telling people that chiropractic can cure the coronavirus. Don't do that. Don't do that. That's not good. First of all, it's not true. You don't know that it's true. There's no data to support that whatsoever. Secondarily, regulators are looking at us all, and they're watching the things that we're doing and saying. There was just a study that came out that looked at what claims were being made on chiropractic websites in Denmark. And there was a high percentage of claims that were being made that were non-musculoskeletal claims. Now, if you've been in chiropractic practice for a long time, you know that when we take care of patients, there's a lot of great things that happen aside from getting rid of their back and neck pain. But when it comes to making claims that can't be supported by the scientific evidence, it gets chiropractic into trouble, and we can't afford that right now. So please, if you're going to make any statements, they have to be accurate. They have to be evidence-based. Again, we're staying in touch with our patients through email blasts. There's great text messaging services out there. There's Zingit, there's ReviewWave, there's Sked, there's DemandForce. There's all kinds of ways that you can stay connected to your patients through text messaging. And then, of course, if you're an app customer of ours, a Kaizenovate Canvas app customers, we've created some enhancements for you as well. We can put stuff across the banner, the top banner. We've got communication enhancements. We've got telehealth that's already built into the app through ExamMed. Same thing with web exercises, that's already built in. And of course, we've got an assessment. So if somebody's at home and they want to give it to their husband or tell their friend about it who lives across the street because they hurt their back, their friend can take the assessment on the app. You know, they download the app, they take the assessment, and then our clinical algorithm will actually give that individual exercises they can do that might help their back pain. So again, these are ways that we're trying to help providers stay connected to their patients. And we've had our own app now for a really long time, and we're trying to help other practices stay connected through the app as well. And again, if you have any questions about that, feel free to reach out to me. Again, I'll share my email address at the end. So speaking of staying connected with providers. So we have faxed and we are calling every single one of our referral sources and letting them know we are open, that we're providing telehealth services, and that we're providing online content for our shared patients. And we're also offering, our online classes as well. It's a great way to connect with our referral sources. I made calls today, and I got to tell you, they were so appreciative. One, that we were open and able to take care of their patients. Two, that they couldn't believe that we had telehealth. They're like, wow, you guys have telehealth? That's great. I'm going to tell the rest of the doctors on staff. Like, okay, that's great, because we're here to help you, and we're here to help your patients. But when it comes to things like standing out, we're standing out because we have built the infrastructure. We had enough vision many years ago to adopt technology. Now we're able to leverage that technology, whether it's telehealth or web exercise platforms or our own custom-built app for our patients. And, our referral sources are they're pretty remarkable. So even if you don't have all those technologies, but you reach out to your referral sources and you find ways to connect with them, let them know what's going on with your shared patients. Let them know what you're doing to connect with them, offline or online. Just communicate with them so they know what's happening. You're going to create much greater loyalty from your referral sources by doing so. And then lastly, practice, excuse me, there's so many resources that are coming available to help your practices economically during these times. There's SBA loans, Small Business Administration loans. There's state programs as well in Maryland. There's a couple of programs that we've seen in our local area. I've already submitted those applications for loans. Don't have any shame applying for loans. Access to capital is critically important in business stability. So you don't always have to use the money, but you want to have access to capital. And then, of course, the CARES Act that came out, federal monies that are going to small businesses to help them through these very, very difficult times. Right now, at the time of this webinar release, we don't know too much about it. I mean, there's lots of information, but the application's not even out yet. But I would say probably by the end of the first week in April, applications will be there, and they'll be starting to get filled out, and we can start to apply for these programs. They're really good programs. I think this is one area that the federal government has actually kind of come together and done a good job. They've done a good job for the Family Protection Act, which is really more for individuals, and they've done a really good job, I think, as it relates to helping businesses get through this. They learned a lot from the 2008 financial crisis. I saw an interview of someone who works at the Federal Reserve, and they talked about the lessons learned from 2008 during the financial crisis, and they weren't going to make those same mistakes again this time around. And based on the activity of the federal government, I got to give them credit. They've acted, and I think that's going to be beneficial for all of us. Again, keeping a cool head, spending time working on the business, understanding what these programs are, reaching out to your banker, reaching out to your accountant, all really important to help you understand and navigate all of these programs. Also, if you're a member of your state association, most state associations are putting out content on a regular basis. And if you're not a member of your state association, you need to join it, because there's a lot of people working their asses off on your behalf, and your dues actually help really elevate the profession. So yeah, I'm kind of lecturing you right now, but join your state association. You've got an ethical responsibility to join your state association. And even if you've had an experience where they haven't done everything perfectly in the past, it doesn't matter. Like, you need to support your state associations financially. And then if you're not happy with what they're doing, then get involved, become a leader, and facilitate change. So that's my little 5-second soapbox deal. So anyway, state associations are coming out with great content as well. So be on the lookout for that on listservs, et cetera. And then lastly, performance. All of these ideas and these concepts around positive mindset and having meetings and making sure that you're doing all the personal health and well-being stuff and communicating with providers and communicating with your patients, all great ideas. But if you don't execute, none of it matters. Like, ideas without execution are just dreams, all right? So now it's time to literally buckle down and create some traction for your practice. So again, as I stated early on in this webinar, keep calm and take decisive action. Just maintain your level of calm. And again, it starts with, positive mindset and making sure that you can make a different decision through that whole belief system, the five primary drivers, growth mindset, that you can learn and grow, having grit. All of this comes together so you can take decisive action. Love this slide. Plan your execution and then execute your plan. For the first, I would say, 10 days of this entire crisis, when it started hitting us at home, I was reacting. I was reacting to everything. And then I finally was like, okay, stop. Like, there's a lot of stuff going on. I'm in the whirlwind right now. But if I don't sit down and actually have a plan and get my leaders to actually have a plan, we're going to be running around like chickens with our heads cut off. And so all of my leaders, I challenged them. I said, guys, let's have a plan. Let's sit down. Let's make a plan for the company. Let's make a plan for each one of our individual departments and clinics, and let's execute that plan. And that has served us extremely well. So plan your execution and execute your plan. Again, Arianna Huffington, vision without execution is hallucination. Just another way to say that, if you're just having ideas and not executing them, really nothing happens. I love this quote by Morris Chang. He is the CEO of Taiwan Semiconductor, part of AMD. He says, without strategy, execution is aimless. So you're just running around doing a bunch of stuff like I was doing the first 10 days of this crisis. Without execution, strategy is useless. Love, love, love that quote. So both are critically important. So again, to the point of plan your execution and then execute your plan. Again, what we use in our practice and our company is something that I call the chiropractic entrepreneur framework. We set our vision, like our North Star. We create the right kind of culture by bringing the right people on the bus. We measure through KPIs or key performance indicators. We focus on process and discipline in our process to make sure that they're actually creating the kind of value that we want to create for our customers, our patients, and our company. We focus on operations, which is an OPS, which is operational problem solving. We all have issues in our business, but we've got to be able to solve them. And ultimately, all of those gears that are moving drives growth. And it drives personal growth, it drives professional growth, and it drives financial growth. And so this is the framework that we use in our practice, and that's how we execute the strategies that we create. This is just one example of a strategy. So our Director of Business Development, Lucas, who many of you have seen probably on some of our webinars, he challenged the doctors to come up with content that we could be sharing online to connect with our patients and that our referral sources could use for their patients. And so there was a very specific thing that needed to get done for creating content. What's the type, what's the setting, what's the quantity, what's the frequency, what's the platform, what's the delivery platform, and when will it get done by? So who's responsible, what's going to get done, and when will it get done by? These are the ABCs of execution, you guys. Like, if you're having meetings with your team and you're not answering those three questions, who's going to do it, what's going to get done, and when is it going to get done by? You got a lot of hallucination and a lot of dreams. You're going to be so frustrated. Clarity is the key to success and execution. Clarity for you and clarity for your team. And you may feel like, oh man, I'm being like a nag or I'm being like a micromanager. No, you're not. You're just ensuring that there is understanding and clarity around how shit gets done. And that's what you need to do as a leader. That's your responsibility. We use traction tools as our overall business management system. We're able to look at all of our key performance indicators, our to-dos, our goals, which we call rocks, our issues list, our customer and employee headlines. We're able to look at all this information in one technology platform, and it is remarkable. And again, if you're interested, we can talk to you about that at a future date. So it's about building your strategy, measuring your results, and then learning from that and iterating. every decision that we make in crisis management is not going to be the right decision. Some of it ties to ethics that I talked about earlier. Some of it ties to process or operations or marketing or safety or quality. But we've got to be able to measure what we're doing, to the point that I made earlier around measuring our patient loyalty as it relates to our telehealth consults. And then we learn from that, and then we iterate, and we build an even better mousetrap. We build a better strategy. We execute, we measure, we learn. This is called Kaizen. And you guys might wonder why we call our company Kaizenovate. Kaizen is the Japanese word for continuous improvement. And I combined the word Kaizen with innovate, which is Kaizenovate, which is continuous improvement through innovation. The first word that I actually created was Kaizenovation, but it was too hard for people to say, so now we just call it Kaizenovate. So to Kaizenovate is to innovate through continuous improvement. So in case you're wondering how we came up with that crazy name. So final thoughts. These are some of my most favorite quotes, and I want you to think about the people that are associated with these quotes. Know thyself. Again, being self-actualized is one of the most important elements of being a great leader, having great self-awareness. Convey authority and warmth. So when you're having these meetings and these communications with your team, be real, keep it real. Because when you keep it real, you keep it honest, you keep it open and transparent, you are conveying a level of both authority, but also openness and warmth. Be humble. Jim Collins in his book, Good to Great, Chapter 1, Level 5 Leadership, he talks about the difference between a good leader and a great leader is humility. It's the notion that you put the business and the people in the business before your own needs and before your own accolades and aspirations. Great leaders put organizations and people and countries and companies before themselves. And so humility is a really, really great leadership trait. And don't confuse humility with a lack of confidence. Some of the world's most amazing leaders are incredibly confident, but that doesn't mean they're not humble. That doesn't mean they don't listen to other people on their team or their customers or their patients. So be humble. Know the power of feelings. Everybody, we talked about this at the very beginning with David Bayer's 5 primary drivers. Your employees are feeling things. Ask them, how are you feeling about this? How are you feeling about your situation? Are you scared? How are you feeling about the decisions that we're making? So you've got to go there with your team. So know the power of feelings. But for goodness sake, be tough in a crisis. Now is not the time to be a weenie when it comes to making decisions. You just got to do it. Make a decision. If it doesn't work, try something else. And you know what? Tell your team when you fuck up. It's okay. You screwed up. Hey, I fucked up. It wasn't a good decision. We're going to make a new decision, okay? Let's make a new decision. What's the best decision? Do some question storming. Find the best questions. Drive the best solutions. So be tough in a crisis. Don't be a weenie. Support people's talents and unique abilities. Through this process, I've seen people on my team take their talents and just escalate them. They're leveraging their unique abilities to take something out of nothing and create something new for our business. And it's because that's what they're great at. That's what they're world class at. So understanding people's unique abilities and what really drives them and motivates them, support that and watch your organization just thrive through a crisis. Know what makes employees stay and know what makes them leave. And the short answer to this, guys, is employees typically stay or leave because of their direct manager. So if they love you, they're going to stay. If they hate you, they're going to leave. If they're indifferent to you, they're going to leave. So understand that and develop the relationships that you need to develop with people on your team. Put your people first. Put your people before your patients, and you'll see that you'll create a tremendous amount of loyalty. And that loyalty drives remarkable patient experiences. You look at every great leader, Richard Branson at Virgin, Tony Hsieh at Zappos, Gary Vaynerchuk, they all talk about the same thing. It's your people that are first, not your not your patients, not your customers. Take care of your team, and your team will take care of everything else. culture is what you do, not what you say. So it's really important that you have these meetings, that you go there, you ask the right questions, you have these open conversations. But at the end of the day, if your behavior is contrary to the things that you're talking about, your culture is going to suck. So make sure that you're aligning with the mission of the organization through your behaviors and not just your language. Managers are about processes, leaders are about people, and I could beat this dead horse all day long because I've already talked about it, at pretty great length towards the end of this webinar. Look, managing process, very, very important for a successful organization. But at the end of the day, when it comes to really executing and watching a company go from 0 to 100, it's really about leadership skill and understanding your people, their unique abilities, their needs, their wants, their desires, how it aligns with the mission of the organization, tying that all together, creating the right strategy, executing the right strategy. That's what leadership is. For God's sake, take a risk worth taking. I mean, this is Martin Luther King. He literally laid down his life for the civil rights movement. We have important decisions that we make every single day for the health of our teammates, for the health of our family, for the health of our business. Take risks, take educated risks, take calculated risks. But again, when it comes to making decisions, don't be a weenie. Serve the greater good and you will be inscribed in the book of life with love. This is a picture of Anwar Sadat. A great man, a great leader. He put his life and his entire political career at risk for peace in the Middle East. And that's what leadership is. And my favorite quote of all time from Thomas Edison, who failed way more times than he succeeded, who said, "Our greatest weakness lies in giving up. The most certain way to succeed is to always, always, always to try just one more time." It's that one more step that you take. It's that one more try that you take. It's that one more ounce of effort that you put out there that ultimately gets you to your light bulb moment. So do it. Just keep at it. Have the grit. Have the perseverance. Leverage your passion for what you do to drive through these difficult times and truly create change. So again, guys, thank you so much for spending this time with me and listening to this webinar on leadership through Crisis Playbook. We've got the coronavirus playbook on our website. You can go to Kaizenovate.com. If you have any additional questions, myself and other people on my team, we're here to support you. You can just email me at Kaizenovate.com. drj@Kaizenovate.com. Reach out to me. Again, I'm here to support you guys. I'm here to support the profession. I'm here to support the public that we serve. I'm here to support our planet. And so I just want you to reach out if you need anything and I can be of help. Lastly, you guys can see that I'm wearing this t-shirt. This is actually our company t-shirt. These are our taglines for Kaizo Health: rethink, rebuild, restart. And I want those words to stick with you. We're going to rethink what we're doing. We're going to restart our practices, our lives, chiropractic's position, rightful position in healthcare today. And we're going to restart stronger than ever. So love all you guys. Take care of yourselves. Take care of your families. Take care of your teams. Take care of your patients. And if there's anything that we can do to help you, please don't hesitate reaching out. Thanks again for spending this time with me. I'll talk to you all soon. Bye now.